So moving on from the theory and applying it in real life, we've got a case study of a 32-year-old guy who had a complex injury playing football, valgus collision and a pivot. His MRI scan when we saw him showed a complete ACL rupture, an MCL grade 3 rupture that's now chronic and hasn't healed, and a medial meniscal red-on-red tear involving most of his meniscus, probably the posterior 2/3 or so. When we got in to actually do an arthroscopy and examine his knee, gross opening of the medial joint compartment, Lachman's positive with a gross pivot shift. So once we were in the knee, as you can see, the meniscus is very unstable. We used a shaver just to freshen things up to allow some bleeding edge and for it to heal. Using the first FiberStitch, measured it to 18, penetrating just above the meniscus into the posterior capsule, feeling it move through the capsule, then advancing the first suture device, rotating that wheel backwards, then all the way forwards, removing it back into the joint, going underneath the meniscus, again making sure that we can see where we're going, penetrating all the way through the capsule to the other side, again advancing the needle all the way backwards, all the way forwards until we feel that click, and bringing it out through the joint. We then identify the loop, pulling it, which tensions the first device, and then pulling on the long string, which brings the second suture taut. We then use the suture cutting device, bringing that into the knee and just trimming that off. This is a very unstable one and needed multiple sutures, using the skid in the pack just to protect the articular cartilage, bringing the second FiberStitch. This one we decided to do in a slightly different manner, doing a horizontal mattress type suture. You can see using the needle, you can actually see the first device loaded and ready to go, going through the meniscal tissue and then through into the capsule, and then advancing the first FiberStitch into the posterior capsule, and bringing the needle back into the joint, careful with the cartilage, and then moving along in a horizontal fashion, again penetrating the meniscus, then the capsule, and advance the second FiberStitch into the capsule of the joint. Bring it back into the knee, pulling on the loop just to snug that suture down. You can see it really pulling the meniscus into the capsular rim. Pull the spare length and just closing things down. Again using the cutter just to trim that completely.